in English. Cholinergic agonists, also known as cholinomimetics. First, let us clear the terms cholinergic agonists and mimetics. Acetylcholine comes, it binds to the receptor, shows internal action. That is, this is action. When any drug comes and binds to the receptor, shows the internal action, is given the name agonist. But if it is showing the actions like choline, acetylcholine, then we will call that drug the cholinergic agonist. Very simple. It is also called cholinomimetics. Mimetics means mimicry, to copy. So these drugs are acting and copying the actions of acetylcholine. They are acting just like acetylcholine. That's why they are known as cholinomimetic or cholinergic agonists. Very simple. Here we have got two types: direct acting cholinergic agonists, indirect acting. Direct acting, first let us clear the terms. Direct acting means if you take a drug, that drug comes and binds to the receptor directly and shows internal action, is known as direct acting cholinomimetic. Okay? The word is called indirect acting cholinomimetic or cholinergic agonist. Very simple. They are given the name indirect because they are not acting on the receptor, they are acting somewhere else. Then where? When this acetylcholine enters this synapses, then here the enzyme is available to break this acetylcholine into parts. Now these indirect acting are given the name indirect because of the reason they are acting on these enzymes. When these indirect acting drugs bind to this enzyme, then this enzyme is no more available to break the acetylcholine. So like this, they are just increasing the amount of acetylcholine in the synapses. Then acetylcholine will show its action on the receptor available on the postsynaptic neuron. So like that, they are helping and they are mimicking the mimicry, they are doing the mimicry of the acetylcholine. So they are given the name as indirect. In short, once again, direct acting will come, directly bind to the receptor and will show the actions like acetylcholine, and indirect acting drugs will come, will bind to the enzyme. And after this, when they bind to the enzyme, they will cover, they will block the enzyme from what? Then they will not, you can say, decompose or split the acetylcholine into parts. When there is available acetylcholine, then the actions are available or shown. So like that, their acting is the agonists. So we have got two types, direct and indirect. Now let us understand one after other. Direct acting agonists are of two types: endogenous cholinesters, alkaloids. These direct actings, we have got acetylcholine is also used, methanocol, carbachol, and we have got from the plants, name is alkaloids. These are the plant extracts: muscarine, pilocarpine, nicotine. They're obtained from the plants and they're also acting is like acetylcholine. So that's why we put them in the category of direct acting cholinomimetics. Acetylcholine has got a very diffused kind of action. When you take acetylcholine drug, it will enter to the body and it can show number of actions. Like how? You will remember this from your body. Simple. When you are in the rest and in the digest mode, what will happen? The neurotransmitter involved in the parasympathetic nervous system is acetylcholine. It will do what? Your eyes will be accommodated for the near vision because now you are in the rest and you are doing rest, you are just about to digest also if you got somehow of meal. So what will happen? In short, the mechanism of action of acetylcholine is like that. It will bind to the receptor and it will do what? It will do, you can say, meiosis, pupil size contraction, pupil size will decrease for the near vision, and you can say there will be a kind of lacrimation, sweating will be there in the body, and I'm coming through the body, okay, making you understand. Then you can have salivation, GIT mortality will be increased, and obviously bladder movement will also be increased when you are in the rest. So these are the actions shown by the acetylcholine. But because of its diffuse action 1, Number two, because of its, when you administer acetylcholine, it is also broken down by the enzymes known as pseudocholinesterase. So because of these two reasons, we are not recommending the acetylcholine clinically. So clinically it is not used. In short, bethanychol, the modified form of the acetylcholine, structural is modified and it is used specifically. Action is the same. They will bind to the receptor and will show action, but it is specifically used to control the movements of bowel and bladder, GIT and urinary. Carbachol, its clinical uses for the GIT and cardiac. And alkaloids, the plant's extract. Muscarine is there, nicotine is there, and pilocarpine is there. The most prominent use of from the alkaloids that we discuss clinically, that is pilocarpine. So pilocarpine is actually used for the secretion purposes. It is increasing the secretions throughout the body. You can say the pilocarpines are actually piling on the secretion. It piles on secretion. So it is more prominently used in case of glaucoma, which is eye disease. Further, I will make you people understand in the next video about the glaucoma. So this is the plant extract, direct acting. And in the indirect acting, we have got reversible and irreversible. Reversible is that which will bind temporarily, but irreversible will bind with a covalent bond and will not be detached. So as long as the enzyme is available, the drug will be in the covalent bond form, and then its enzyme's action is lost forever. But in case of reversible, it can be reversed. We have physostigmine, neostigmine, and edrophonium, and some have other drugs also in the reversible. And why do we take these kind of categories? Again, because of specificity of the actions. Physostigmine, this is having the structure quaternary and can cross the blood-brain barrier. It can penetrate the central nervous system. It is responsible to control somehow actions of the GIT and bladder or intestine. And neostigmine is the same, having property to show actions of intestine and bladder, and the same is the case with the edrophonium. Then what is the difference of the clinical usage? Clinically, the physostigmine, neostigmine, edrophonium, they've got a very specific, the point that I'm going to discuss right now is very specific for everyone of these drugs. Physostigmine. Somehow atropine, there is a drug that is causing, its poison is controlled by the physostigmine. So physostigmine will counter the action of the atropine. Atropine poisoning is clinically controlled by physostigmine. And neostigmine is used. By the way, we can say it was used. But now edrophonium has got its place. We can say we have replaced, or the edrophonium has replaced the place of the neostigmine. Neostigmine is specific in its action because it cannot cross the blood-brain barrier. It is acting at the peripheral areas. And its action was more specific for two diseases. One is a disease, another is another toxicity. A disease is of myasthenia gravis. Now, what is myasthenia gravis? Another disease. I will make people understand in another video. Glaucoma and myasthenia gravis, we will understand these. But now we will make it short a little bit because of the battery charge and battery memory size. So, well, neostigmine is used to for the diagnosis of, it was used for the diagnosis of the myasthenia gravis. Edrophonium was also used, and it is used now also. The reason is because of what? Because of the time duration. Its half-life is 30 to 2 hours, but the half-life for edrophonium is 10 to 20 minutes. So in order to get the better diagnosis and quick diagnosis, we prefer, and the doctors preferred, the practitioners preferred the edrophonium, due to which neostigmine got aside. So now edrophonium is clinically used for the diagnosis of the myasthenia gravis. That's it. And we have the toxicity of tubocurarine. Their toxicity is also controlled by the neostigmine. Now this is a kind of toxicity. I will answer you this in the comment section, and you can ask us other questions also in the comment sections if you want to ask. Well, we have irreversible now. Irreversible are 1, 2, 3, and some other also like ecothiopate, isoflurofate, malathion, parathion, and etc. They're irreversibly binding to the enzyme. Then they will not be detached for